Are you looking for an effective solution to manage type 2 diabetes that also offers additional health benefits? Discover why metformin hydrochloride is considered a game changer in diabetes treatment and beyond. Title: Metformin Hydrochloride, a comprehensive guide to the leading type 2 diabetes treatment.
Listen to the following talk.
Metformin hydrochloride is a medication primarily used to treat type 2 diabetes mellitus. It is an oral hypoglycemic agent, which means it helps to lower blood sugar levels. Metformin is often prescribed as a first-line treatment for type 2 diabetes due to its effectiveness, safety profile, and benefits beyond blood sugar control. Here's a detailed overview. Mechanism of action. Metformin works primarily by decreasing glucose production in the liver, hepatic gluconeogenesis. Additionally, it improves the body's sensitivity to insulin and enhances peripheral glucose uptake and utilization. Unlike some other antidiabetic drugs, metformin does not cause significant increases in insulin secretion, which reduces the risk of hypoglycemia, abnormally low blood sugar levels. Pharmacokinetics, absorption. Metformin is absorbed in the small intestine. After oral administration, it reaches peak plasma concentrations in about 2.5 hours. Distribution. It is distributed into the body tissues, particularly in the gastrointestinal tract, liver, and kidneys. Metabolism. Metformin is not metabolized by the liver, which is advantageous as it does not interact significantly with other drugs metabolized by the liver. Excretion. The kidneys excrete metformin unchanged in the urine. Therefore, it is crucial to monitor kidney function before and during treatment. Indications. Metformin is primarily indicated for type 2 diabetes mellitus, to improve glycemic control in adults and children over 10 years old. Polycystic ovary syndrome, PCOS. Off-label, it is sometimes used to treat PCOS due to its effects on insulin resistance. Obesity, off-label, it may be used for weight management in individuals with insulin resistance. Dosage and administration. Metformin is available in various forms, including immediate release and extended release tablets. The starting dose is typically 500 milligrams once or twice daily, with gradual titration based on patient response and tolerance. The maximum recommended dose is usually 2,000 to 2,500 milligrams per day, depending on the formulation. Side effects. Common side effects include gastrointestinal issues, nausea, vomiting, diarrhea, abdominal pain, and loss of appetite. These are more common at the start of therapy and often subside with time. Lactic acidosis, a rare but serious side effect characterized by the buildup of lactic acid in the blood, which can be fatal. Risk factors include renal impairment, liver disease, alcohol abuse, and conditions associated with hypoxia. Contraindications. Metformin should not be used in individuals with severe renal impairment, eGFR below 30 milliliter min 1.73 metascleride, acute or chronic metabolic acidosis, including diabetic ketoacidosis, severe hepatic impairment, acute conditions associated with hypoxia, e.g. myocardial infarction, sepsis. Drug interactions. Metformin can interact with several medications, including cimetidine, can increase metformin plasma concentration. Diuretics can enhance the risk of lactic acidosis due to dehydration. Contrast media, used in radiologic studies, can cause acute renal failure, increasing the risk of lactic acidosis. Benefits beyond glycemic control. Cardiovascular benefits. Metformin is associated with a reduction in cardiovascular events and mortality. Weight management. It may help with modest weight loss or weight neutrality, an advantage over some other antidiabetic medications. Cancer. Emerging evidence suggests a potential role in reducing the risk of certain cancers, although this is still under investigation. Monitoring patients on metformin should have regular monitoring of renal function before starting treatment and periodically thereafter. Blood glucose levels to assess efficacy. Vitamin B12 levels. Long-term use can interfere with B12 absorption, leading to deficiency. Summary. Metformin hydrochloride is a cornerstone in the management of type 2 diabetes due to its effectiveness, relatively low risk of hypoglycemia, and additional health benefits. However, it requires careful patient selection and monitoring to avoid potential adverse effects, particularly lactic acidosis. This is merely a sample of material for learning English. Thank you for watching.
This is a VTP channel. You can find us at youtube.com/@VTP. How do you feel about this video? Please leave a comment below. This is a summary of the content.
Metformin hydrochloride is widely recognized as a first-line treatment for type 2 diabetes due to its ability to effectively lower blood sugar levels and improve insulin sensitivity. This comprehensive guide explores the mechanisms, pharmacokinetics, indications, dosage, side effects, contraindications, and benefits of metformin. Learn about its additional health benefits, including potential cardiovascular protection and weight management. Understand the importance of monitoring and managing potential risks to ensure safe and effective use of this vital medication. Whether you're a patient or healthcare provider, this article provides valuable insights into the multifaceted role of metformin hydrochloride in managing diabetes and enhancing overall health. This is merely a sample of material for learning English. Thank you for watching. Below are several keywords along with their respective definitions.
Here are the definitions of the 22 keywords.
1. Metformin hydrochloride, an oral medication primarily used to treat type 2 diabetes by lowering blood sugar levels. 2. Type 2 diabetes mellitus, a chronic condition characterized by insulin resistance and high blood sugar levels. 3. Hypoglycemic agent, a substance that reduces blood sugar levels. 4. Insulin sensitivity, the efficiency with which cells respond to insulin. 5. Hepatic gluconeogenesis, the production of glucose by the liver. 6. Peripheral glucose uptake, the process by which cells in muscles and other tissues absorb glucose from the blood. 7. Immediate release tablets, formulation of metformin that releases the drug quickly into the bloodstream. 8. Extended release tablets, formulation of metformin that releases the drug slowly over time. 9. Gastrointestinal issues, common side effects of metformin, including nausea, vomiting, and diarrhea. 10. Lactic acidosis, a rare but serious side effect of metformin involving the buildup of lactic acid in the blood. 11. Renal impairment, reduced kidney function, which can affect the excretion of metformin. 12. Cardiovascular benefits, positive effects on heart health associated with metformin use. 13. Weight management, the role of metformin in aiding weight loss or preventing weight gain. 14. Polycystic ovary syndrome, PCOS, a hormonal disorder sometimes treated with metformin to improve insulin resistance. 15. Pharmacokinetics, the study of how a drug is absorbed, distributed, metabolized, and excreted in the body. 16. Dosage and administration, guidelines for the amount and frequency of metformin intake. 17. Contraindications, conditions or factors that prevent the use of metformin. 18. Drug interactions, the effects that other medications may have on the efficacy and safety of metformin. 19. Vitamin B12 deficiency, a potential long-term side effect of metformin affecting the absorption of this essential vitamin. 20. Efficacy, the ability of metformin to produce the desired therapeutic effect. 21. Safety profile, the overall assessment of the risks and adverse effects associated with metformin use. 22. First-line treatment, the preferred initial therapy for managing a medical condition, in this case, type 2 diabetes. This is merely a sample of material for learning English. Thank you for watching.
What do you think of this video? Please provide your feedback below. This is a VTP channel. You can find us at youtube.com/@VTP.
Thank you for thinking about subscribing to watch more exciting videos.